There's a theme of social justice in what I do that I take very seriously. These people fought for our country. One of my hopes is that I contribute in some way to a system that is delivering really top quality care to a really diverse group of people. Right now, when you see patients and you discover something, you might be a little discovery that you just as an individual physician might have, and the patient may benefit from that. But we haven't really done a great job kind of harnessing all those really, little individual discoveries to, feeding it back to kind of what we understand about humans and how they respond to disease. And actually, you know what I study physicians and I study decision making. With either the inhaled steroid or if we take the time to pay attention to really smart physicians who are deviating from those guidelines for really good reasons. Those are moments where the physician is adapting their knowledge to their setting, and they're contextualizing their care, and they're being creative, and they're coming up with a solution that maybe our evidence base has not really appreciated. And those are areas where we can learn how to optimize care for more people, not just the people who are well represented in our evidence base, but for a lot of people in different settings. Working in the Veteran Health Administration, you feel like you're part of something that's really big and really important. We all share this mission to give the best care that we can to this group of people that we owe so much to. Being a mom now, going on skis with my kids, it might be the funnest part of the whole thing. I don't know. I started skiing when I was 2, and we would shuffle around the farm, and that was what we did in the winter. That was kind of our play. And when I started racing was kind of when I was in elementary school, and mostly I was just trying to keep up with my sisters, and they would constantly ditch me, and my very patient mom was always the one who was helping push me up the hill and stuff. My experience of international competitions was always World Cups in Scandinavia and Europe, where there might be 20 to 80,000 people watching. And then bringing that to Salt Lake was really kind of surreal. The experience of the Olympics, the course is perfect, everything is perfect, there's a huge crowd, and that's all really neat. But the value that I feel like I really got of being an Olympic athlete was actually the journey to that, which was the, building relationships through suffering, getting out there on really rainy days with your teammates and really working hard to try to achieve some goal and really kind of learning about your friends and kind of creating a community through that. So that was really the value of the Olympics to me, was actually those friendships and relationships that I built, in the process. Veterans, they're about as diverse as every other group of people, but if you were to generalize, they don't ask for very much, and it's like the least we can do. There's so many people who sacrifice so much. And I'm a pulmonologist, so I don't talk to them about their experiences of the war, or, why they have PTSD visits every week. But I do feel a pretty strong mission to provide the best care that they have, regardless of their socioeconomic status and, where they live. And that's really important. When I had kids, any moment that I'm away from them, it actually better be well used. And so in some ways, it really raised the stakes on how I spend my time at work. Because if it's not really fun, or it's not really, I think, making a difference, then I might as well be home with my kids. The only reason I'm not with them all the time is that I really love what I do.